see if I can get in the center. So I wanted to post a video with just some quick program updates, nothing big, but some reminders and things for weight loss program people that we want to make sure that we cover. So I want to go over messaging, ordering refills, the best ways to get a hold of us, how to handle dosage changes, monthly fees, website resources, and plateaus. So if you're watching this video to get started on the weight loss program, if you go to our website, which I will have written down at the end, but is www.erinfusions.com. There is an intake form on the patient's page that allows me to get the information I need to prescribe you anything. And once I see that intake form pop up, I will contact you for either a telehealth or in-person consult. And then you will also, on the weight loss page, fill out whether you want billed for your monthly fee on the 1st or the 15th. That can all be done from our website. If you hit the patients tab, there is a specific tab for the weight loss program and everything is there. There is also forms for the pharmacy because we pay the pharmacy directly. So you have to fill those out and send them in as well. As far as messaging goes, texting is always good on the phone number that's listed here. There is also a patient portal on the patient's page of our website. You can sign up for that, or email. The Facebook messages get to be a lot. There's a lot of spam, so they take a lot longer to see. So if you're wanting refills or have urgent questions, Facebook would not be the best way to get a hold of one of us. It would be better to call or text the phone or use this email here, or use the patient portal. Okay, drawing up meds. Some people have difficulty learning how to do that. If you go to the weight loss program page on the website, there are some written instructions that are very helpful. There's injection logs so you can keep track of what dose you're using. But if you're at all confused, we are happy to arrange a FaceTime if you're out of town, or you can bring your vial in and we will help you figure out drawing up and units. It gets confusing with units versus milligrams. All I can say is units are what are listed on our syringes, so I would not pay attention to milligrams at all. If you stick with units and you're using the number of units that are on your package, then you will have the correct dose. So the markings on the syringes are always units. But if you have questions, of course, reach out to us. Ordering refills, it's about a week or less lead time right now for a refill. So when you have a dose left in your vial, that's a good time to order. The best way to do a refill to ensure that you get the right thing is the request refill button on the weight loss page on our website. You can use text or email. I prefer you don't use Facebook just because those messages get lost, they get blocked. We get spammed and have 10 things in there and it can get missed. The request refill button is nice because it has you choose what medication and vial size you're wanting, and then I don't have to reach back out to you or play phone tag or whatever to get your refill ordered. I can just take that form, order your refill, and it's done. I've had a lot of questions about monthly fees. Why do we have to charge a monthly fee? The only money that Vitality receives from the weight loss program right now is the $75 monthly fee plus tax. It's $80.25. We allow you to choose between the 1st and 15th. But I have a lot of people saying, well, I don't order a vial every month. Here's the thing. It costs a lot of money to even insure the weight loss program. And yes, I have to have insurance to prescribe those medications. I have to have staff here. I have overhead. So I feel like that is the least that I could offer our services for, especially since you're getting the medications for cost now through the pharmacy. When we charged you vial pricing, we made profit off those vials. We're not making any profit off those vials anymore. So, in order to pay staff, pay overhead, pay insurance, pay licensing, the $75 monthly fee will apply to everyone every month. If you don't pay in 10 days, I will cancel your reoccurring invoice, and hopefully offer your spot to someone else. If you believe that it was a mistake or got lost in your spam, I'm really understanding about that stuff. I will reinstate it, but we need to have a conversation. So I just wanted to let you know what the monthly fees were for, and that is the only money we receive. The money that you're paying for the medications is going directly to the pharmacy. I want to encourage everyone to take a look at the website, because there are a lot of resources there. Everything that everybody asks about is there. The patients page has the intake forms in the portal. The weight loss page, which is under the patients tab, has all the pharmacy information, the forms they need to take your payment. It has injection logs. It has the weight loss quick start guide, which is nice to figure out protein and fiber and diet suggestions. It has the request refill button, and under the dosage guides, the pricing for the vials is there for both semaglutide and tirzepatide. So you can see how much is being charged to you by the pharmacy. I would like to point out that shipping is $40 because it's overnight shipping. The medication has to be shipped on ice. There is not anything I can do about their shipping charges. It's just the cost of getting the medication here and have it still be good for you to use. To touch a little bit on dosing and plateaus, again, numbers in the syringe are units. Remember that dosing is in units. We really don't focus on milligrams with this medication because of the way that we dose it with units. If you're having an increase in appetite, reach out to us. We can help you increase your dose. We can decide if we need to take a break from the medication and do a medication holiday. There's a lot of options to help you. But reach out and ask for a visit or a phone visit, and we can figure out, your individual situation. If you have questions, texting and portal messaging is always the best way to get a hold of us more promptly than Facebook messaging. I'm really trying to discourage the Facebook messaging just because sometimes I don't get them, and sometimes bots pick up messages and then spam. Like I said, then I have 30 messages to go through and something might get missed. It's just not a great way of communicating, and that's why we have Gabby doing the website so that it's making things more accessible. I will also mention that for our aesthetics clients, if you go to our, I think it's a services page, it might be products, but the Glymed store is now active. There's also a order form for Circadia and Face Reality products. So you can order like face wash or serums or lotion or whatever products that you want, lip balm, and we can drop ship it directly from the manufacturers now. So that is kind of a nice thing too. I will just remind everyone of our contact info. We are right next door to New Cara on G Avenue in Grundy. Here is the phone number. Calling or texting is perfect. There is also an email here, and the website is the best source of information. Everything is laid out nicely so that even for aesthetics or weight loss or whatever services you're interested in, all the information should be there, and our contact info is there as well. So the big thing is just try to avoid the Facebook messaging, and let's try to utilize the other forms of messaging so I don't miss anybody. So just let me know if you guys have any questions or need anything. We are always here.